Wishing you the best for the day ahead, Madam Siti Suraya and my lovely Group 2 team members. Hope all of you are staying safe and healthy with your loved ones. I am Darshni Pubalan, is going to talk about the title Know About COVID-19. As you all know, the COVID-19 pandemic has caused significant disruption and hardship in nearly every aspect of our lives. Do we aware how many among us know about what is COVID-19 and its risk? Actually, COVID-19 is an infectious disease caused by a newly discovered coronavirus that has spread throughout the world. This coronavirus can spread easily from one person to another person. Most of the people fall in sick with COVID-19 will experience from mild to moderate symptoms and recover without any special treatment. However, evidence to date suggests that there are mainly two groups of peoples that are at a higher risk of getting severe COVID-19 disease. The first group of people are those over 60 years old, and the second group of people are those underlying medical conditions, for example, such as cardiovascular disease, chronic respiratory disease, diabetes patients, and cancer patients. Therefore, it is really very important that adults in this age range protect themselves and also in turn protect others that may be more vulnerable. Last but not least, as said by Helen Keller, alone we can do little, but together we can do much. Thank you.
Good afternoon, Puan. I'm Shashi Taran, one of your students from JEG 200. Today I would like to present about how does the COVID-19 to be spread into the community and also the human body. This COVID-19 is one of the high dangerous viruses has been categorized by all over the world, which is currently killing up to many people. Even today, there is no recoverable medicine has been found out so far to cure this killing virus. As you can see, these viruses separate through hair. The first thing, this virus can be separate through hair, which is meaning to say someone who infected is getting face to face us when they are talking to us. These viruses can be transferred into us within below 1 meter distance, which means to say someone, whoever the infected person is getting near to us, before within one meter distance, they very easily can get through the COVID-19 virus. That's why the government encourages to wear the face mask all the time. It's mandatory and necessary things we have to do to follow the SOP requirement. In other term, we can see this COVID-19 can be separated through cough and sneezing. Here we can explain that when someone whoever infected with the COVID-19 virus, because the symptoms we cannot see directly or immediately, it will take up to 14 days to get to know what are the actual things happening in the body, and also throughout some tests have to be done to confirm on the virus infection. Therefore, whoever get infected with the COVID-19 virus, they will be cough or sneeze to other person. It will be immediately be transferred to other person's body where we get infected, which will be not be aware about the infection has been transmitted to our body by other person. So, and also the surface, because this virus can be contaminated into the surface area, whereby the person who were infected from the saliva or anything, they touch it and then they put it on the touch the hand through the some of the surface areas. Another person who go and touch it that place, it can be also separate through that as well. So those are the viruses that can be separate. Those are the virus COVID-19 can be separate through to the human body very easily and quickly. So we have to maintain the distance, and also SOP has been set up by the government to avoid this COVID-19 to be separate throughout our body. Thank you, ma'am.
Greetings and hello to everyone. Let me introduce myself. My name is Divyashini, daughter of Chandraju. Now let's move on to the topic. The topic today is how to protect yourself and others during this COVID-19. My point here is practice social distance. What is social distance? Social distance is keeping a safe gap between others. So, which is not your household? How to maintain this social distance? Social distance have to maintain during each of our conversation with others. Furthermore, the social distance is meant by 2 meter gap. 2 meter gap is 2 arm length. 2 arm length which we have to maintain during the conversation with others. Every time we have to keep in our mind to maintain a social distance. Even though we are wearing a face mask which is already so protective, but social distance is a new norm which we have to practice. In our workplace also, we have to practice this new norm. Even though we are having a conversation with others or we have to eat in one place, we have to practice this social distance which is 2 meter. We have to remember the 2 meter every time, everywhere. Nowadays, in every place, they are practicing this new norm. Practice social distance. So, my advice to you guys, young or kids or adults, have to practice this social distance. To flatten the curve of COVID-19, we have to hold our hands together to practice this social distance. Moreover, even though we are having this new norm and it's difficult to apply in our lifestyle, we have to move on our lifestyle with this new norm. Social distance. Social distance is not only a phrase and it must be have to apply in our lifestyle every day. My last thing which I have to mention here is social distance is not only a thing which we have to see and we have to apply also in our lifestyle. Thank you.
Good day. My name is Ilekia Gunasekran. My special thanks for my lecture to give a golden opportunity to present my video. Today, I'm going to talk about know your risk of several illness. Everyone is at risk of getting COVID-19, but adults of any age with certain underlying medical conditions are at increased risk for severe illness for the virus that cause COVID-19. Adults of any age with the following conditions are at increased risk of severe illness from the virus that cause COVID-19. For example, cancer, chronic kidney disease, COPD, chronic obstructive pulmonary disease, Down syndrome, obesity, pregnancy, smoking, type 2 diabetic mellitus, immunocompromise, which is mean weakened immune system. Furthermore, based on we know at this time, adult of any age with the following conditions might be at an increased risk. For example, asthma, cystic fibrosis, hypertension, liver disease, thalassemia, type 1 diabetic, and also overweight. Okay, only this for my slide. As the conclusion, to be fit as a fiddle, we must follow some golden rules in our daily life. Stay connected, forget more tips. Stay strong, stay safe, and stay home. Thank you.
Good day, I'm Kirtana. I'm here to present about how to protect yourself and others from COVID-19. First of all, I will talk about protect yourself. Avoid touching your face. The virus can enter your body via eyes, nose or mouth. So it's very important to avoid touching your face with unwashed hand. Second, wash your hand. Frequently washing of hand with soap water for less than 20 seconds or cleaning hand through alcohol-based solution, gel or tissue is recommended in this method. Third, stay away from infected person. Avoid having close contact with people which is infected with COVID-19. Fourth, avoid social gathering. Avoid physical meeting, events or other social gathering. Fifth, use a face mask. Wear a face mask indoor or outdoor whenever physical distance with other people which can't be granted. Next, I will talk how to protect others from COVID-19. Use a face mask. If you are infected, use a medical face mask which can reduce the risk of infected from other people. Second, cough or sneezing. Cough or sneezing into your elbow. Use a disposable tissue. If you use a tissue disposal, wash your hand. Third, stay at home if you're sick. If you feel unwell, stay at home. It can reduce from attack other people. Fourth, keep physical distance. Physical distance means physical stay apart from other people.
Good morning, I'm Padma here. Today I would like to talk about preventive measures of COVID-19 if we are sick, especially with the symptoms of fever, cough and flu. First of all, we should self-quarantine ourselves in a room at least for 2 weeks. We also cannot connect with anybody even though they are our family members. Second, we should wear mask all the time even though we quarantine ourselves in a room, and also have to change our mask frequently. The third, we should wash our hands with soap and water for at least 20 seconds. If soap and water are not readily available, we should use the hand sanitizer with at least 6% of alcohol. Moreover, we should avoid poorly ventilated cases. We should make sure room have a good ventilation. Self-isolated room should have a fan and window. The window should open all the time and allow good air circulation in a room. The fifth is clean and disinfect. Clean and disinfect frequently touch surfaces daily. Examples: doors, tables, doorknobs, light switches and etc. Use detergent or soap and water prior to disinfection. The sixth is monitor health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath or other symptoms of COVID-19. Take your temperature if symptoms develop. If you have a major symptoms such as continuous fever above 38 Celsius, loss of taste or sense of smell, you need to seek for medical attention. Thank you.